5-minute warning that we will be starting promptly at 8:50. Five-minute warning, we will be starting at 8:50.
Light is on. Now, can you hear me? Oh, okay. Good. Okay, great. I think we're set to go. Oh yeah, we'll just wait for the music to turn off. Awesome. Okay, so welcome everybody, everyone who's here in the room and everyone who's joining us virtually. We're so excited to be here with you for an introduction to the Icelandic Prevention Model. My name's Alyssa Bedard, and I'm a health promotion specialist with the North Bay Parry Sound District Health Unit. My pronouns are she and her. And this is Sandy Gaydal. She is the program manager for the Healthy Schools program at the Health Unit. So as we begin our time together today, I would like to acknowledge that we're gathered on land protected by the Robinson-Huron Treaty of 1850. This land is the traditional territory of the Anishinaabe peoples of Nipissing First Nation, Doki's First Nation, and Temagami First Nation. This land is also part of the unceded territory of the Algonquin Nation. I would like to acknowledge as well the Métis presence in this region. As a settler, I'm grateful for the opportunity to be gathered here together to learn. The Health Unit recognizes and deeply appreciates the contributions of all Indigenous peoples in shaping and strengthening our communities and for being stewards of these lands and waters. This recognition must also be clearly and overtly tied to our collective commitment to make the promise and challenge of truth and reconciliation real in our communities. As we work to create supportive environments with and for young people, we have a responsibility to intentionally disrupt colonial systems of oppression, to listen, learn, and unlearn, and to work meaningfully together with Indigenous peoples in a good way. I'll now turn it over to Sandy to share some logistics for the session this morning.
Thank you, Alyssa. Good morning. We hope you've all had a chance to grab something to drink, to eat, and if you haven't, please feel free to just get up at any time and do that. The washrooms are located through the doors at the back. We've changed the signs to all gendered, so please feel free to use either washroom. The agenda and flow for the day will go as follows. Dr. Zimbalati, Associate Medical Officer of Health, will be giving our opening remarks. We will then introduce you to Jan and Robin from Planet Youth. We will have a short break at 10, followed by some partner experiences, local data, and then we will introduce you to some youth that are from our local schools to give you a youth perspective, and we'll wrap up our day with how you can be involved. I will now turn it over to Dr. Zimbalati.
Nipissing and Parry Sound districts are facing worsening trends of substance use and have higher rates of opioid, alcohol, and cannabis use than the provincial average. The reasons are complex, and no one organization is fully equipped to reverse these patterns. However, today we will learn how we may achieve success working together. You have all heard the expression, "It takes a village to raise a child." This is particularly true of complex social and health issues, such as substance use. A whole of community approach will be necessary to address the risk and protective factors that shape this issue. By decreasing substance use in youth, we also may be able to alter patterns of substance use into adulthood. As representatives of health, education, social services, municipal and recreational organizations that regularly engage with youth, your support is needed to bring this whole of community model to fruition, and we can all benefit as we work together. I'm optimistic that today will mark a turning point in our community's efforts to effect real change, and you will be able to look back with pride to say that you were here at the beginning. This morning would not have taken place but for the extraordinary efforts of some members of the health unit staff, most notably Alyssa Bedard, a health promotion specialist, and Sandy Guindon, the program manager for Healthy Schools. They were supported by numerous others, including Louise Gagne, our executive director for community services. Many thanks to all of you. I also want to thank the Grand Event Center for accommodating us this morning. We are very fortunate to have with us today two Planet Youth speakers who have been involved in developing the original model in Iceland, as well as translating the model for implementation into other countries. I was at yesterday's event in Parry Sound, and myself and a few others had the opportunity to sit down with our Planet Youth speakers, Jan Sigfússon and Robin Katrick. So I know you are in for an inspiring and informative morning. So without further delay, I will ask Alyssa to come back up to introduce our honored Planet Youth speakers.
Thanks very much, Dr. Zimbalati. So, our first guest speaker today will be Jan Sigfússon. Jan is the chairman of Planet Youth, serving internationally as head of the Planet Youth Guidance Program, which is an evidence-based project of primary community-based health promotion. Jan served as the director of the Icelandic Center for Social Research and Analysis for 20 years. Paralleling his main responsibilities, Jan has served as a board member in various international entities such as European Cities Against Drugs, Europe Against Drugs, and more. Jan has served as coordinator on various projects aimed at enhancing social factors and well-being of youth and promoting effective intervention based on proven methods, including Youth in Europe and more. He has been nominated to numerous initiatives across Europe and with the United Nations that aim to improve knowledge transfer between the fields of research, policy, and practice. Jan has held lectures on evidence-based primary prevention at conferences worldwide for years and has more than a few publications focusing on youth in international peer-reviewed journals. Jan is a family man, a proud father, and grandfather of many children. Our other guest speaker today will be Robin Katrick. So Robin is a public health and community development professional with extensive experience in primary prevention, program development, and community mental health. She lives in Vermont, United States, and is the community development advisor at Planet Youth. Before joining the Planet Youth team, she facilitated implementation of the Planet Youth methodology in Vermont and supported communities in creating healthy built environments through strategic planning efforts, cross-sector collaboration, and statewide partnership building. In previous roles, Robin has also worked in community health promotion, direct service and mental health, and international community development. Robin holds a master's in public health and a Bachelor of Arts in community development. So I want to thank you both so much for being here with us today. Jan and Robin have been doing a bit of a Northeastern Ontario tour. They started in Timmins, they went to New Liskeard, Parry Sound yesterday, and here with us today. So they've been quite busy, but we're so grateful to have you. So I'll turn it over to you.
Good morning. Somebody have my slides, or? Thank you. It's an honor for us to be here. Thank you very much for the invitation. As this is said, we have been traveling a little bit and already love Ontario. And that's not difficult actually, because as I mentioned yesterday in Parry Sound, according to international polls, Canadians are the most likable people of the world year after year. So we have to be back. Thank you very much. You see this? I'd like to start by showing you this picture. It's taken downtown Reykjavik, the capital of Iceland, in 1997, 1998. It's the middle of the night, daylight of course, at that time of night. And the town was full of young people, and far too many of them were using substances. And in 97, 98, Iceland scored the highest, or among the highest, in substance use amongst adolescents in Europe. So the situation was grave, and we needed to do something. As an adult at the time, we didn't, dare to go downtown even. So we took a look at what we had been doing before. And when I say we, I have to emphasize this. It's all the people working on prevention in Iceland. Parents, the schools, education, health, police, church, practitioners, politicians, everybody. I will say we again, so that's we. So what we had been doing was trying to teach kids how to take responsibility of their own well-being, making them responsible for how they would succeed in life. Do this, don't do that. And in our case, that was simply not working, so something else had to be done. And this started in 95, 6, 7, 8, but last 2017, an article about the work in Iceland was published, and this was the title: Iceland knows how to stop teenage substance use, but the rest of the world is not listening. And that article simply went viral across the world, totally out of control, and we didn't know anything about it. It was published in so many languages, I don't know them. But all of a sudden, the phone started ringing, emails pouring in, and we were asked if we would help and at least show others what had been done in Iceland. So basically what we're doing, we're telling you a story, what we did. And this is what everybody wants to achieve. This graph shows, I don't know if I'm standing in the way of, do you see the screen there? It's okay. So in 98, 42% of our 15 and 16-year-olds had become drunk for the past 30 days. Now this is down to 5%. 23 were were smoking daily. That's gone. However, there are new things popping up, vaping, nicotine pads, always new challenges, so we always have to be on the guard. And in 98, 17% of our 15 and 16-year-old had tried cannabis, and that's down to 6-7% now. And we achieved this in 15 years. So in 2013-14, we were already down to the figures where we are now. So from 98 to 2013 was the downward trend. And we are in close collaboration with everybody, of course, in Iceland, also the Metropolitan Police. And they show us figures about theft, vandalism, sexual abuse amongst older adolescents. And these numbers have, at the same period, also trickled down. You know, drugs and violence is kind of sister and brother. Now, international development. We are now working in 5 continents, in 16 countries, all over the world, and yeah, telling people the same story everywhere, and trying to adjust and adapt the methodology. And that has to be done. I mean, we cannot say that whatever works in Iceland works everywhere else, but the frame, the structure, that is always the same, and then we need to adapt to the local conditions everywhere. I know a question is going to arise, who funds this and how much does it cost? So with your permission, I just answer it before. The fee for all our work, this is, we make agreements, 5-year cycles, 5-year agreements, and 31,000 euros is our fee for everything that we do, and Robin will show you more about what is after. And the funding structure is, we need people to realize that nothing happens overnight or in 6 months or 1 year. So we say, we work with you for a minimum time of 5 years. So funding needs to be guaranteed for 5 years. And this is being done in so many different ways. Australia, there's a federal agency, Argentina, local government, Mexico, state government, and there are NGOs. So it's the municipalities themselves. And I always mention in New Zealand, in Papakura, where we are working with the Indigenous, that it's the football association. So there are so many ways to fund this, just wanted to mention it, but 31,000 euros per year for a local unit. Now, how was this changed? We work, again, everybody, according to these 3 pillars. We always use evidence as a base for decision-making, not our feelings. We always have to know what we have and what will happen if we do this, what will happen if we do that. And we cannot make any experiments when it's the lives of our children that are at stake. We have to know what we're doing. So empirical evidence is key. Community-based work is another key, and Robin will come to that. You can work in your area. You can make changes here, but you cannot make changes in the whole of Ontario or the whole of Canada. So it always has to be local. And the 3rd pillar of success is the dialogue between policymakers, practitioners, and researchers. So these have to collaborate. If a researcher collects data, publishes a paper, and doesn't tell anyone about it, it's not really helping the practitioners. And why research-based? Again, wherever you want to succeed, it doesn't matter which area that is. I mentioned here medicine, engineering, tourism, fisheries. everybody uses research. So when it comes to the most important in our lives, our children, we have to use research also. We have to base our work on evidence. And what we have been doing is focusing on curing the society instead of the individual. Of course, there are individuals who are in need, and of course, we need to do everything possible for those individuals. But the Icelandic Prevention Model is, as we will mention later, it's very much upstream. It's trying to prevent a bad thing from happening before it happens. We had a lot of data when starting to look into what could be done in 97, 98. Data from the primary schools and the secondary schools, and this data had been collected on a population level, all schools in the country, with an around 80% response rate for 4 years. And the questionnaires, luckily, they had all sorts of questions about the environment of children, not only how much you drink and smoke, but your relationship with your friends, your family, your leisure activities, basically everything of importance in a life of an adolescent. And this was our luck, basically. There are so many questionnaires who just ask, let's say, how much you drink. We do that. But we can also tell you why is it that you drink from these factors. And every time data is collected at the Icelandic Prevention Model, Planet Youth Model, we deliberately divide it into 2 parts, practical and scientific. The scientific part is where we publish papers from, and our team has published somewhere around 150, 60 papers in international journals on youth and well-being and all sorts of items from the data that we have. The last one was last year in the Lancet about mental health at the times of COVID, for example. And this can take a year, 2 years, 3 years, 4 years. But the practical role is that we feed information out immediately to the relevant society or municipality. So if there is a data collection this week in your schools, within 6, maximum 8 weeks, all of you will have the findings. You will have the situation, and you will have the risk and protective factors in your local area. I'll come to the risk and protective factors in a minute. So the feedback, the immediate feedback of information is crucial, because then you know that this is information about your kids right now. And you can decide if you need to do something. Maybe everything is fine. Maybe there is something that you need to improve. And then you can do that. You could sit around the table and make decisions. But so it's not information or data about children 1, 2, 3 years ago in your area, or even where in some places where we have been working, people don't have local data. They only have country data. And for you to have country data, or it's not worth much in the local work. You need to have your data immediately. Local and fresh, just like vegetables, local and fresh is the best. And that's what we do. And the reports are, we issue municipal reports, school reports, and then also infographics for parents. And of course, the schools decide what they want to do with the results, if it's going to be distributed or not. It's all confidential like that, but at least there's the chance of making a coalition like Robin will talk about the results. And the reports are very descriptive. It's not hundreds of pages of text and Excel sheets. It's very graphic and for everybody to understand immediately. Now, if you come back with me to 1998, this is where scientists started looking deep into the data and trying to find if there was something there that could be used in the work in Iceland. And scientists saw correlations between certain factors in the environment of children and the fact if they started to use drugs or not. So they tried to establish in our local area the risk and protective factors. This, of course, had been done before elsewhere, but maybe not taken as long as we did it. So we tried to realize what makes a child not start using substances and what would lead towards using substances. So risk and protective factors, and these are the four main domains of intervention in the Icelandic model. The family factors, the peer group, the school, and the leisure activities. And from the data, it was possible to see that children who spent more time with their parents said it was easy to have caring and warmth, said that their parents knew where the children were at night and with whom. These children were less likely to start using drugs. So we could tell parents that. We didn't take that to the children. We could tell parents and teach them, basically, how they could be the biggest preventive factor in the lives of children. We could see the positive and negative effects of the peer group. One example I had yesterday was like hanging out late at night, doing nothing, just idling. We could see that was a risk factor. Kids who did that were more likely to start using drugs. And then the school, of course, hugely important. And we could see that children who reported that they felt well in school and they liked their friends and the teachers and were feeling good, they were less likely to start using drugs than those who said that they were bullied or feeling bad for some reasons. So that information we could take to the schools. And finally, the leisure activities we saw were hugely important. And we could see that young people who participated in leisure activities 3-4 times per week or more were less likely to start using drugs. But these activities needed to be two things. They needed to be organized, not just random. They needed to be organized by a club or something like that. It could also be arts. And it needed to be of a high quality. The quality of the activity needed to be good. You needed to make sure that you had, let's just say, I often mention basketball. If you have a basketball trainer, that person would need to be good at what he or she was doing, a good role model for the kids. And also with an education in this. I mean, if your child goes to school tomorrow morning and it's mathematics, you assume the teacher is capable of teaching that, he's trained to do that. And the same we had to demand when our kids went to organized activities, that the quality was okay. And if I would stop the presentation right here and say nothing more, what Iceland has been doing is trying to strengthen the preventive factors in the lives of children and weaken or eliminate the risk factors. And this is basically the work everywhere we go, in all the 16 countries, it's always the same. And this can be different from country to country, but still the same. So in '98, the government decided to fund a 5-year project called Drug-Free Iceland. And everybody laughed, drug-free Iceland, how stupid can you get, But this was done, supported for 5 years. And then after that, the municipalities, they had started to see the positive effect of this, and they basically took over. The municipalities have been driving this since, more or less. So we often talk about upstream innovation. This is, of course, very visible. We need, if somebody falls in here, we need to help that young person, of course, always. But at the same time, we need to go up here and build fences so the young people don't fall in. And that is by addressing the factors I just mentioned. So, my last 3 slides, working with Planet Youth. We have guiding principles that are being used everywhere. We apply a primary prevention, emphasize the community work, and engage the whole community into the work. We integrate researchers, policymakers, practitioners. These always have to work together. And in Planet Youth, we match the scope of the solution to the scope of the problem. So when you have the accurate findings, you can know what to do. Far too often, we have seen even governments throw lots of money in that direction. Check, we have put $1 million into prevention without actually knowing if it was needed there or if it could have been used differently. So this methodology makes sure that you use your money and resources in the best way. You know what you need to do. And there is a guidance program that Robin will also mention that we go through. It seems a lot when you take a look at these steps, but year by year by year, there's something new. There is always something happening, starting by making a local coalition and the funding, and there is a pre-data collection. We require a very high response rate so that we can be sure that what we are telling you is correct. There is data collection, step by step by step. We guide you through this in the period of 5 years. And there is always something happening. And Robin knows that best. And the community focus. That has to be key. You can change things here in your area. We were up in Timmins 2 or 3 days ago, and we said, practitioners in Timmins, they have absolutely no need for information from Whitehorse or vice versa. You have to be local. And I think Robin is going to rescue me now, right? Thank you.
Hi, everyone. So I'm Robin Katrick. I'm the Community Development Advisor at Planet Youth. So my role really is helping communities figure out what you need to do to work through those 10 steps. I help you figure out your structure. We troubleshoot together. Planet Youth really is a supportive approach where you're not alone in going through these 10 steps Jan was just talking about. I want to talk a little bit about the community-based approach that was mentioned so much. And step 1 of our guidance program is building a local coalition. And this is key for the entire project because your local coalition is going to build that foundation so you can be successful in this work. So step number 1 is a strong local team helping support the local project and help build healthier environments for young people. The coalition makes it easier to go through the 10 steps because you are working with a various amount of stakeholders that know the community best to really work through data dissemination, goals and strategies, figuring out what the community needs and wants. The local coalition also has the local knowledge. We keep talking about how this is a community-based approach because you know your community best. We're not going to tell you what to do. A coordinating group is not going to tell you what to do. That's up for you to decide. So identifying this coalition is key. And this often happens, well, during your Planet Youth process, but even before. A lot of communities, before they even sign on with us, have started developing a coalition, but this is something you will revisit throughout the whole time. And the coalition is focused on primary prevention, and it should not be rushed. You want to really develop this so that you can be successful in your work. So I'll talk a little bit about stakeholders. We encourage that you bring all members of the community to the table. This is not an exclusive group. And a lot of people say Planet Youth is different because I know we have a lot of coalitions. We all work on a similar goal or a topic, but this really brings together such a wide variety of groups that you're working together instead of in silos. So you're really working toward common goals. You want to make a healthier environment for young people. So this is really important. The local coalition is not just a team brought together by like an upper coordinating group. This really does have a lot of local ownership. You're not just following guidelines brought down from us. This is a team, sorry. Thank you. Can you hear me okay now? Perfect. This is not just a team that's brought together by a coordinating group and telling you what to do. It really is a local community effort. Here's some examples of what the stakeholders can look like. Every community is different, so what I show you here may not look what your community is going to be like, but that's okay. You may include some of these groups, though. Elected officials and policymakers, civic and volunteer groups, community serving organizations, mental health professionals, healthcare, public health professionals. Social scientists and research are sometimes on the local coalition, but there's not always researchers in a small community. I know this from my experience in Vermont, so you can sometimes use outside expertise to consult with, but then the local ownership really is with that local coalition still. You can bring together leisure time professionals and organizations, faith community, law enforcement, parents and caregivers, of course, and then schools. And I do want to say just a quick note about schools, and I'll talk about this in a little bit as well. The ownership doesn't fall in the schools. I know a lot of time with this work and with youth well-being, schools feel responsible or like they're having the community blame them for things that maybe that are going on with the young people, but this is a community-based approach. The community is responsible for making sure youth are well. Schools should, of course, be a part of this, but it's not the responsibility of the schools to take this on. So as we mentioned, this community-based approach. You know your community best. So this is all you. We're not going to tell you what to do. A coordinating group is not going to tell you what to do. You know your avenues that you need to take to reach intended outcomes. You know the outcomes that you want. So that's why this process is really special and really important. It really does put that ownership back to you. And just as I was saying that the coordinating group should not make decisions for a local coalition, or Planet Youth shouldn't make decisions for a local coalition, I also want to emphasize that a local coalition should not be making decisions for an entire community without actually listening to the community. So an important part of this process is gaining feedback from the community. That 10-step process that we walk you through is really important because you receive that data back, and then you take that data to the community and you listen to them. You ask them how they feel about this data. You ask them what their idea is for reaching goals and strategies and what would work best for them. So there's a lot of feedback happening throughout this process, and the coalition listens and then creates the goals and strategies and really helps move the work forward. And of course, an important role of the coalition is to develop influence in the community. So it's not making the decisions for the community, but it's really listening it's making sure people understand, it's building awareness, it's really being the implementers of this. So often a stakeholder group that I always mention that's not on that little chart I showed you of all the stakeholders is a community champion. Sometimes community champions don't fall in a specific stakeholder group. I have a feeling I'm going to be playing with this mic the whole time. So the community champions sometimes are a person that doesn't fall in a stakeholder group and they develop influence in the community. They are the ones that can make the community move forward with action. And you want to think about that as you're creating your coalitions. And I will say that this work requires a lot of patience. The primary prevention is long-term work, and sometimes it can feel like you're not seeing those quick wins that I know, at least in Vermont, we have grant funding, so every year everybody's like, what did you do? What is the outcome? This isn't a process that's like that. It's long-term, it requires patience. However, working through this process is progress, and that's an outcome, and that is what I consider a win, getting through coalition building or disseminating data and creating goals and strategies. These are all moving forward in your community. So I'll talk a little bit about benefits of local coalitions. There's so many, I could spend a whole presentation on this, but I'm just gonna talk about a few today. And the first, and probably one of the more important ones, is this coalition helps you from duplicating efforts. Often we work in our own individual silos, working towards same goals or similar goals, but we're all in our individual organizations working on these goals and not together. This coalition really helps bring people together, helps them communicate, and it avoids duplicating efforts in the community. It also empowers the community and local stakeholders to take action together. So when you really start talking about youth well-being and realize where the goals align and where stakeholders have been kind of doing similar work, it can empower the community to take bigger action together. And it can build excitement. As someone who has worked in community health for a long time, I know how burnt out you can feel, especially if you're working within your individual organization toward goals, and it can feel like, when are we going to achieve these really big outcomes that we want? When you bring together this coalition, when you focus on the goals and strategies, the 10-step process, it can rebuild that excitement. It can make you feel like you have a team and you can work on this together. And it increases communication. When you're meeting together regularly, you're figuring out what everybody's working on, you're able to assign tasks, you're able to review the data and more. And of course, it combines resources to have a greater impact. And when I talk about resources, I don't just mean funding. Of course, funding is a great resource, but I'm also talking about time to do things and take initiative. I'm talking about skill sets. This is what I mean by resources as well. And it creates long-term and permanent change. The goal of this coalition is to have a permanent coalition, and you keep building upon it, and you keep revisiting it, and you keep making sure everybody's at the table that needs to be at the table. So this can have a long-term impact in the community. So I want to talk a little bit about project structures. I know a lot of people ask this when they think about implementing Planet Youth in their community. They want to know what this could look like. What I'm going to show you is just an example of a project structure. Again, you're going to know your community best and what they need, so it may not look like this, and we can help you figure that out if you do choose to move forward. So of course, there's the Planet Youth team. We're always in contact with you. I'll talk a little bit about how that works. You get assigned a project manager, you have an advisor, and all this good stuff that will keep you in constant communication with the Planet Youth team. And then the Planet Youth partner is typically the next step where our go-to contact is this person. And it's usually someone within the organization that's signed on to Planet Youth. Sometimes there's a regional coordinator. I have heard that your community is fairly small, so I don't think that would be necessary. In our smaller communities, we don't typically need a regional coordinator. We have some bigger sites such as Chile, and they have 300 communities, so they definitely need extra regional coordinators to support. And then the community teams. So that's the local coalition I was just talking about. And within each of these steps, you're never too far away from the Planet Youth team. We're there to support, we offer trainings, we're always in contact, so the open communication is flowing throughout each of these levels. Now I'll talk a little bit about the coalition role, just so you have an idea of what that looks like, because coalition is so foundational to this work. That's why I'm focusing so much on this. You are there to inform, motivate, and initiate the community work. Again, you're not there to make all the decisions for the community, but you're there to really move the work forward. And they work collectively to work through the steps and make sure they're creating healthier environments for young people. So that's really the overarching theme of the coalition. And this can look like a lot of different things. However, you could expect a coalition to work through data dissemination, making sure that the survey goes on in the schools without any troubles, creating goals and strategies, building community awareness. These are all different things that the coalition would take on. So I'll talk a little bit about next steps. Regardless if your community chooses Planet Youth is good for you, like these are all next steps that you could take if primary prevention is something that you're really interested in. Being clear with the community, the stakeholders, and the coalition about how the goals align and how you can work with each other. I think that's so important, is to make sure you figure out where the alignment is amongst all the work you're doing in the community to support youth well-being. And then being specific about strengths and resources the stakeholders bring to the coalition as well, making sure people know why they're at the table. If people don't know why they're at the table, they don't know the skill sets that they're bringing that are so important to the coalition, it can make them feel like maybe it's not the right place for them. And then demonstrating to the stakeholders how Planet Youth can support the goals that they're already working on. Often if you bring together the stakeholders, you can find alignment across all the different goals and things that are being worked on in the community. And then getting to know your stakeholders. So this is my favorite part of coalition building, because you never know the skill set that stakeholders are going to bring to the table. I often find school principals saying, oh, I love to do graphic design, can I help create materials? Or business owners that really want to get involved in sports and leisure time activities. And so if you don't ask what these hidden interests are of your stakeholders, you're never going to find that out. So that's one of my favorite parts of coalition building. And then you want to create a team that really knows each other. You're going to spend a lot of time together. You're going to do some difficult work together. So you want to create a team that really wants to work together. And then build trust. I always say don't make promises that you can't follow through on, whether that's with the coalition or the community. Building trust means you are really clear about what this work is and what this work isn't. Making sure if you do create a goal or strategy, you follow through on that. So what we do when we're working through this with communities, helping them create goals and strategies, we often will tell you to be realistic, especially in the first 1 or 2 years, because you want to make sure that when you're promising something to your community, you are actually following through on it. And then I promised I would come back to this slide, and I will say it again, and it's so important. Make sure schools are on board and they have this support, because they are going to be implementing the survey, and schools are often a hub for stakeholders and young people in the community, so this is often a gathering spot. They're a really important part of primary prevention. However, the work does not fall on the schools. This is a community responsibility. And then remember to advocate for the community. You're there to really listen to the community and figure out what the community needs. You know your community best, but make sure you're listening and gathering that feedback throughout the entire process. So I'm going to talk a little bit about tools, resources, and support from Planet Youth. So we just emphasized how important the community-based approach is, but I want to talk about if you do want to sign on with Planet Youth, if you're working with us, what you can expect. We value a lot of things at Planet Youth, but especially reliability, transparency, learning, and growth. So we aim to be reliable. If we promise something to you, we're going to deliver on that. And we're very transparent about what we can and can't do. So like I just said in that previous slide, we don't make false promises to our communities about what this is. But we also value learning and growth. Every community is different. This is an adaptable process. So what works in one community isn't going to work in the other community. So we listen to you, and we learn and grow with you throughout this. And every community teaches us something new with this process. Some examples of how we support our Planet Youth partners are through training. So we offer a 6-part training series. I'm going to talk about that a little bit in a few slides. We also offer trainings if it doesn't fall into the training series, but your community needs something specific, we are usually able to create something for you. When you sign on, you're assigned a project manager. So you have one-on-one support. You usually meet every 2 to 4 weeks, and they really help you through each step of the process, but they're also the people that will connect you with the rest of the team. So if you need advising, the project manager is going to connect you with me or one of the other advisors. If you need something from analytics, they'll be the ones to connect you to them. We also offer advice, so you're going to get a lot of localized advice and support about your data, about how to create goals and strategies, what's worked well in other communities. So we're there to support that. And then, of course, the data analysis and reporting, something that I know is super important, especially to smaller communities, is having that localized data that is turned around quickly. We do turn data around in 6 to 8 weeks, and we have really great reports for not only you, but we also send reports to the school, and that is just for the school. So the community reports, the coalition can decide whatever you want to do with that and how to disseminate it. The school reports go directly to the school, and that's for them to decide what they want to do with. I'll talk about a few of our tools we have, and we have a lot, but I just wanted to emphasize and highlight a few of them. This one is the Community Implementation Guide, and it's a 92-page guidebook, so I don't recommend reading it all at once, but it does break down the 10 steps, and you can focus on the step you're in. It tells you what the step is, why it's important, how other sites have done activities under that step, and just some good information to get you moving forward. It also talks about our evaluation and data analysis, and tells you how maybe you want to talk about Planet Youth in your community and how to create an elevator speech. So there's a lot of good information in there. When our partners sign on, they get this guide. If you're not signed on, we do have a shorter guidebook, and I'll be sending that out with a link after this presentation today. And here are our workshops. So as mentioned, we do have a training series. Sometimes we create trainings outside of the series. We have an intro to Planet Youth and a coalition building training. So I love the coalition building training. I'm usually the one that leads that one, and that's all about how to build your local teams. And we often do this in communities after they've gotten a few people to the table and want to expand their coalition. We have a preparation for data collection, and this is all about how to get the survey set up in your schools, what you can expect from reporting, and any questions you may have, whether it's about youth confidentiality or how to implement and disseminate the reports in your community. After you get the data back, we do a results review with you. We make sure you understand what the data is saying, what you may want to highlight in the community based on what we're seeing, but we also listen to you to make sure we're understanding what's going to be important for the community. We help you create dissemination plans, and then after you disseminate your data and get that feedback from the community, we're going to help you create goals and strategies that are based on the data. Another great tool we offer is just connection and sharing to other sites. We have a lot of other sites around the world. They have a lot of great information that you may want to implement in your community. So one of the things that we offer is a knowledge sharing and connection through a Facebook group. We call it the Planet Youth Community. All our partners are on there, and it's really fun to see them troubleshoot or share really great successes with each other. We also have cohort calls. There's a North America cohort call where all the Canada and North American sites meet on a quarterly basis and talk about what they're doing. And then finally, I'll talk about this last tool. There's process follow-up. So if you're wondering, okay, if we're working through this process and how do we know we're on track? Who's going to tell us if we're not on track? And that's what the process follow-up is. It's a survey completed every 6 months, usually by the community lead or whoever wants to take that on. Goes through the 10 steps. We ask you what you're doing, and then we create some really great reporting for you based on what we're hearing in that survey. And that's where we come in and offer an advising meeting. So this is another great tool. You can revise your action plans without going too far into the process. And I'm going to take a little break from talking at you. We have some partner experiences, but I think we're going to take a break first, if I remember correctly in the agenda.
Thank you both, Jan and Robin. At this time, we are going to open it up for a few questions. We will have an opportunity later in the morning for questions as well. But we're hoping this has sparked a little bit of interest in the many hats most of you are wearing in the room, and that you might want to dig into our experts. Normally, something like this is a 2-day conference for them, so we've really asked them to condense everything. And there may be pieces that you're still wondering about that they didn't get to because of this condensing. So if you have questions, we have a microphone. If you are nervous to speak to a microphone, you can ask one of our staff and we will speak for you. So we will open it up now. Yeah, thank you.
Hi there, I am Gay Smiley. I'm a superintendent with the Near North District School Board. And thank you for coming and presenting this to us. It's very interesting, and it certainly is hopeful to think that something like this, could be applied to our community, which, we understand is different from the community that you had first had applied this, the method to. But what I'm curious about is in the first picture that you had shown us back from, I think it was 1997, with the youth on the street at 5 a.m. in the morning. Is that correct? It was 5 a.m.? Oh, 3, okay, sorry. From where I was sitting, it looked like a 5. And so what I wanted to know about was how you factored in the time of year, the daylight that was present during that time of year, and how much that was a factor in kids congregating together. And I'm also a little bit curious about the sorts of substances that were being dealt with. I mean, I realize that these are all just some of the variable pieces, but it's just something I was wondering about. Thank you.
Thank you for that very much. Well, it could have been taken also in October, but then we would have needed a flash or something. This was the whole year. It was not only in the middle of the summer that young people gathered. It was a constant and grave situation, and it was kind of a norm, It was okay to go out and have fun in that way. And there was a sense of urgency amongst the adults in the city and in the country. And we can read now articles from that time, newspaper articles, where parents are calling out for, what can be done? Can the government do something? Can the municipalities? Can we? And yeah, so there were, it was coming from so many directions that this needed to be changed. This was not normal. And scoring among the highest in substance use in '98 was not acceptable. But scoring among the lowest 15 years later was something that we were, of course, really happy with. And the substances at that time, it was mainly alcohol, mainly alcohol. The access to cannabis at that time was not that good, but cigarette smoking was considered okay. But I would like to say that, I mean, since you're asking about this, that what we see then is that the substance use follows the cohorts, the birth cohorts. And I think I mentioned this in Paris Sound yesterday, yeah. So you have to hear it again. When we had brought down the substance use amongst the 15 and 16-year-old to this level, that follows throughout the high school. And in 2000, 18% of all high school students had never become drunk, 18%. Last year, in 2022, 53% of all our high school students had never become drunk. So it doesn't work like immediately when you start high school, you have to start drinking. Like that was the case when I started high school, somewhere in 1970 something. So yeah, getting to them, changing the environment and these conditions at this young age is critical. Do I answer your question? Thank you.
Zimbalati with the North Bay Symphony. I'm interested in your numbers. This is 15 years when you saw the big decline. So those people that have students who have been exposed to this community work are now parents themselves. Has any research been done in asking the students who were students at the time, going back to them and finding out how they are raising their children and what kind of message they're giving their children at this time?
That's a very good question, thank you. Well, actually, if we stick to my country, to Iceland, and you were a young parent, like under 30 years or old or something, and you would be asked about the Icelandic Prevention Model, you would say, what model? Because the change in society has become such that parents, nobody notices any longer, you know, how parents are behaving and acting, and the leisure and the schools and everyone. It has become an integrated way of working. So, of course, some of these, I don't know what happened with those who were using the most substances at that time, 25 years ago. But as I say, the main thing is that a parent today is more likely to raise a kid in a healthy way than at the time. We have changed the norms. We have had all sorts of campaigns and directed towards parents, and we could talk about that probably for a whole conference. So we changed the norms. That's what it's about. It's okay? Thank you.
Hi, good morning. My name is Kathleen Rochon. I'm the mayor of West Nipissing. My question revolves around implementation in communities like we're here in North Bay today. We have representation from the North Bay Health Unit and through social services, through the Social Services Administration Board. But our area actually covers several smaller and rural communities. So West Nipissing is 15,000 people. Mattawa is 2,000 people. So how does one adjust for these models in kind of more of a regional rollout that will address the differences both in population and makeup in the communities, and also address, we had somebody speak from the school board here, the fact that we actually have 4 school boards within our region, and how to bring all those partners together and kind of address the needs of some very small, very rural communities. Thank you.
That's a great question. Thank you so much for asking that. So something we do recommend is when you're signing on, you think about what that municipality looks like. You define what the municipality is. So some of our sites are very small and rural, and they look at the school as the hub. So maybe there is 4 rural communities feeding into one school, and they'll consider that a municipality. So at the end of the day, it really is up to you to decide what that looks like. But if you think that an area would be better as one municipality because you have these great stakeholders and resources and a school as the base, then that can be a municipality. We work with a lot of rural communities. Lanark County, for example, is close to you. They are one site, but they have 9 municipalities, very small municipalities, and they come together as kind of one site. So I don't know if that answers your question, but it really is up to you and how you define the municipality and what makes sense for you in your local communities. You want to add anything to that? Okay.
Hello, thank you for your wonderful presentation. It's extremely engaging. I have two questions. So my first question is, you spoke about the fact that improvements take time. So sometimes we won't have those small wins. And I wanted your thoughts on how you keep funders engaged with the project.
That's a good question. Thank you. So just so I have it clear, how to keep funders engaged when you have to look at a long-term process. So part of it is how you talk about Planet Youth and making sure the funders themselves know that primary prevention does take time. Another suggestion is we recommend always that you find a longer-term funding source. I know coming from the United States, that's not always possible. So you have to sometimes work with what you have. So it might be 1 or 2 year funding, and you have to keep finding grants. So making sure these funders not only know that it's a primary prevention project, but also you can find those quick little wins. So working through that process, like I said, is progress. So if you need to report back to a grant, what did we do in this 2 years? I feel like saying we built a coalition of 40 stakeholders that are now working together and communicating together and meeting monthly. That's something I would report back. Or some of the goals and strategies we help you create are going to be smaller goals and strategies that will help you reach those long-term outcomes. For example, if you want to create a leisure card, at some point that's a big project, but maybe in the first year you offer a lot of training to sports coaches so that they'll be qualified in creating organized activities. So that is something that would be another thing you could report back to funding. Does that answer your question okay? Okay.
It does, thank you. And my follow-up question is regarding the changes in elected officials and kind of how you deal with that turnaround of both staff working at organizations as well as elected officials. Thank you.
That's also a good question, because we have had all sorts of experiences in that with the change of elected officials. Let me go back to my country, which I'm, of course, very proud of. We have taken children's well-being up and above party politics. It doesn't matter if you're left, right, or center. It's kids, you know. So that's what we would, of course, like to see everywhere in the world. However, that is not the case. We have been swept out with the change of a government, where everything that the previous government did was bad and has to go away, and we, the new government, are going to do something else. This also happens, but not often, but it's truly a risk factor for the whole work. So yeah, we've seen, I think, all the variables in that. But come on, guys. Do we need to connect this with politics? Children's well-being? Ask your politicians. Thank you.
I have to turn it on. Strong drugs, fentanyl, crack cocaine, and coupled with that, there are currently no detox for children or youth under the age of 18. It just doesn't exist in our communities here. So I'm just trying to think in my mind how we would implement something like that, because I think it's a whole different sort of kettle of fish when we're talking about that level of addictions to those substances, and how do we address that with our youth that are going to require some detox as well as some sort of treatment, which doesn't exist in our communities at the moment.
That's a difficult question for us. Our mindset mindset is kind of always on the first stage, the primary prevention part. That is where we are, trying to change the societies where we work into the direction where this does not happen, you know. But I'm not sure how to answer this question. I mean, we see terrible situation in so many places, and the opioids and all this. It's simply what we are trying to change, but I think we realize that we cannot change it today. But we have to start somewhere in order to not let this happen. I know it's a terribly bad answer, but no, at least it's honest. But we have to help those who are in need if we can, and when we can, of course. But go up the stream, come with us up the stream, okay? Thank you.
We'll let this be our last question, and then we'll move into a break.
Appreciate it. Thank you, and good morning. Thanks so much for the presentation. I'm Brent Kalinowski. I'm the Community Safety and Wellbeing Coordinator for the City of North Bay. The numbers that you started out with and the data and the collaborative over those number of years, very inspiring, to say the least. I'm just curious to know if there's any other correlating data that you've been able to collect, maybe regarding youth activity or involvement with police, justice, maybe health, emergency room. Have you seen any corresponding either reductions or anything like that could show maybe that the reduction in the alcohol use is also translating into other activities or less of some activities?
Yes. Well, again, let's go home. And we see the correlations when we get the figures from the police that has been trickling down amongst, I think the age group is 15 to 23, the numbers that we get, and they're, you know, violence and substance, and theft and vandalism and all that is going down. However, the most encouraging things that we see from the data is that when we see an improvement, for example, in the work amongst in the parental groups and when parents and schools start collaborating more, and you know that network is being tightened, we see that the kids in that area, they use less drugs than where, you know, everything is kind of loose. The same we see when there is an increase in the activities, leisure activities, organized and of a high quality. When that goes up, substance use goes down. So it's like a seesaw. So always, yeah, we see a lot of correlations. Thank you.
We will move into a 10-minute break. There's refreshments at the back, and then we'll call you back to start the second half of the morning. Okay. Hello, we are going to call you back and ask that you are seated quickly so we have as much time as possible for the rest of our presentation. So I'm going to reintroduce Robin. She is going to be taking us through a series of partner experience videos so that you can get a feel of what this has felt like in other communities.
Hey everyone, so it was really nice talking with some of you during the break. I'm going to show you some partner experiences. The first is Melanie from New Brunswick. I think this site can probably be feeling pretty relatable. And they've done some great work with building a solid structure and foundation to move Planet Youth forward. So I'll let this video speak for itself.
Hi, my name is Melanie Cormier. I'm a senior program advisor.
Or not. It sounds like the sound isn't working here.
I'm happy to have the opportunity to give you an overview of our project here in New Brunswick, as well as share our experience with Planet Youth so far. For us, it all started in 2019 when our Chief Medical Officer of Health, along with others from the Department of Health, had the opportunity to attend the annual Planet Youth Conference. Following this, Planet Youth was identified as one of the 12 key priority initiatives in the Interdepartmental Addictions and Mental Health Action Plan back in 2021, and as a key priority under the Addictions and Mental Health pillar of our 5-year health plan, released in 2022. This enabled us to sign a service agreement with Planet Youth to pilot the Planet Youth Guidance Program in 4 pilot sites over the next 5 years. 4 pilot sites were chosen to determine under what condition the model would be best adapted to the New Brunswick context. Selection was made based on various factors that included ensuring a balance of representation of rural and urban areas, of Anglophone and Francophone communities, and the ability to invite First Nation communities to participate, as well as a geographic distribution across the province. We also looked at communities who had common priorities and strengths, and at networks who had demonstrated a strong capacity to work across community boundaries. While the work is funded and monitored by the Government of New Brunswick, it's important that the approach be community-led. Each of the 4 regions have a local action team or coalition comprised of 2 co-leads and members ranging from subject matter experts to health promotion and community stakeholders and volunteers that work closely with the schools in the region. These local teams are supported by a provincial support team to help them shift barriers and leverage enablers that have been identified as challenges or as being out of scope at the local level, as well as identify opportunities for creating policy windows based on the work identified or advanced at a local team level, such as developments that would benefit beyond a singular action team. We also have a provincial coordinator fully dedicated to the implementation of Planet Youth here in New Brunswick. We have had the support of the Planet Youth team since the beginning of planning. The project coordinator and myself have monthly project management meeting with the Planet Youth team, which has been an incredible value in guiding us through the planning phase, trainings, and all the way to now. While we were supposed to start implementation in the fall of 2021, this was delayed a year due to the impacts of COVID-19 in our communities and schools. This past October, a few members of the Planet Youth team joined us here in New Brunswick for an official launch and to announce the 4 pilot sites. Following this, we identified co-leads in each of the 4 regions and started building the local teams. Robin has supported us through this step and has also offered a coalition building training to our 4 teams this past January. This training was very well received and enabled us to engage even more people locally. While these teams are developing, we started planning for data collection. Last week, we invited all of the schools administrating the surveys to attend a pre-data collection training, which was hosted by Planet Youth, and was very informative and prepared the school for the next step, which will be administrating the survey. This will be happening between February 13th and 24th here in New Brunswick. We're very excited to receive the findings early this spring and to start the dissemination and the action planning phases. We have already started planning with the Planet Youth team and have no doubt that they will continue to support us through these important steps. When I first took on the provincial lead role on this project, I was feeling quite overwhelmed and a bit out of place, as most of my career really has been focused on child and youth nutrition and health promotion. This was quickly changed, however, when I started working with Robin and the Planet Youth team. Whether I needed reassurance or advising and sharing ideas from other regions, to some more unique needs, such as the need for all of our resources and training and logos to be both in English and French due to being a bilingual province. They've really been there to support. I'm also very grateful for the connection they've enabled us to make with some of the other regions implementing Planet Youth across Canada and around the world, as well as researchers and national organizations that are interested in this work. Thank you.
So that was New Brunswick. I'm not going to play this video, but I do want to just talk a little bit about it. It is 15 minutes long, so we don't really have time for it today. This is Planet Youth, Frankfort, Kentucky. This will be sent out after the presentations today. They've been implementing a leisure card and parent cafes, and this video really just shows you some examples of what you can do with the data and how to create goals and strategies and the impact they can have. So I'm going to just skip past this, but hopefully you can watch it a little bit later. And I want to move to Planet Youth Calgary. Planet Youth Calgary sent a video that looks at their Indigenous parallel. They are implementing Planet Youth in 4 communities, but alongside that, they're doing an Indigenous parallel. And they had a youth well-being circle where they asked youth about what they want in their community, what's working well, how do they want to be heard, and they filmed that, so I want to share that with you today.
The thing that stood out for me in this program was the youth were given the opportunity to be a part of something where they were able to use their voice. And I know growing up in a city like Calgary, sometimes it's hard to speak up for yourself when things are kind of done for you in school systems or in like the system with child and family services.
To be honest, I was really surprised and puzzled when I was asked to be used as a youth elder for Planet Youth. After some time, I was able to reflect, and I realized it was an honor to be asked to be a part of this. It felt incredible to know that I could be a positive role model for young people.
I really liked the bridging between Indigenous and Western perspectives because I haven't really seen that in many youth programs. It's usually more Indigenous or more Western. They've never been put together in one space.
We would begin each meeting by forming a circle and praying and smudging together, which was usually facilitated by an elder. Youth were able to speak up for themselves and share their truth during our discussions, which was the most rewarding part of the experience for me.
I appreciate, having the opportunity to gather with young people, small groups or large groups, for them to kind of really express themselves and tell us what we need to do, right? As adults, as agencies, as allies, as funders, as policymakers. And I've always felt that kind of was kind of the way to go in relation to how do we change the environment versus how do we change the young person to fit into an environment.
I think the Youth Wellness Circle could help break barriers of like intergenerational trauma because we can work through the wellness of the youth and give them the guidance and resources that they need to work through whatever they're going through.
I'd like to see this initiative continue and our youth confidence continue to grow. I'd like to see many relationships blossom as a result of our interactions. I'd like to see leaders emerge from the group. My hope is that the young people will be given the chance to serve as youth elders as well, and they will be provided with skill sets and knowledge in order to help the next generation.
If I might just for 1 minute mention and follow up this video, we are getting more and more inquiries and Indigenous groups in different countries are looking towards Planet Youth, and if Planet Youth can actually be of assistance, and of course we're going to do everything we can there. We are already working in New Zealand and Australia with Indigenous groups, also in Canada. Washington State sent their tribe leaders to us last year, 18 young people who are studying the Planet Youth methodology and figuring out if they can implement parts of it or all of it into their work as the next tribe leaders. State of Washington is going to send a committee to Iceland in May. Possibly the governor is coming. And they have 43 Indigenous groups and want to try to find out if we can make an example for the rest of at least the states. And of course, we would be really interested and willing to work with Indigenous groups in Canada. Yeah, just want to say that. We trying to do our best. We don't always know exactly what we're doing, but we would like to take these steps with the Indigenous groups. Thank you.
So I'm I'm going to show you one more video. It's also from one of our Canadian sites, Lanark County. This is closest to you. I also think this is a great representation of small communities kind of coming together and completing this project. David Stompy is always happy to talk to people, so if you do have questions after this video, I can always connect you to him.
Good day from the Ottawa Valley. My name is David Stompy, and I'm the chair of Planet Youth Lanark County. I'm pleased to offer my congratulations and encouragement as you consider how upstream prevention can benefit your community. I personally started to learn about Iceland's success in preventing youth substance use at a community meeting in Lanark County in 2017. That meeting was focused on the opioid crisis. An informal group got together, and over the next year, we did some early work that we now realize is step one of the 10 core steps that you may learn about today. We officially formed our committee in June of 2018. As a community-based, volunteer-led initiative, we benefited greatly from mentoring, guidance, and encouragement from our local health unit. This was particularly important as we sought to engage with our local school boards. We also are blessed to have current and former school board employees as active members of our committee. Their guidance was important as we established a formal collaboration with the school boards. This allowed us in January of 2020, 18 months after we formed our committee, to announce that we were going to be conducting our first Planet Youth surveys in March of 2020. Little did we know that COVID-19 would shut the world down a few weeks before our planned surveys, and we would have a 2-year delay. So our reports, our surveys were done in 2022, and just about 8 weeks later, true to their word, the good folks at Planet Youth delivered community and school-specific reports back to us. That's one example of the great service that we've been receiving from them, and I'm sure you're going to agree with me after meeting the folks that you're meeting with today that the people who are working at Planet Youth are top-notch. Now, one question that I had, and perhaps you had, is how is this model going to work in a small community? Lanark County is 9 small municipalities. We don't necessarily have the resources that large urban communities have. I now understand, however, that small communities around the globe are embracing the Planet Youth model. I've had the opportunity to attend virtual meetings, webinars, conferences, and have one-on-one interactions to learn about what's going on in these small communities. And I can tell you that just like the folks who work directly at Planet Youth, the people who are leading this work around the world will, without reservation, answer your questions. These folks openly share their learnings and approaches. We have benefited greatly from this interaction, and I'm sure you will too. If you're interested in reviewing reports from the surveys from Lanark County, I invite you to do so by visiting planetyouthlanerk.ca. You can also visit websites that have been set up by other communities around the globe. I've found ones from the west of Ireland, from Franklin County in Kentucky, and from Blue Mountains in Australia to be particularly useful. Now, in an ideal world, I'd be able to tell you that we're well into step 7 of the 10 steps. That is community goal setting and developing organized responses to survey findings. But the pandemic-imposed delay hurt us in at least 2 ways. One is we lost momentum in community engagement that we're rebuilding. Secondly, we lost momentum in fundraising that fundraising was targeted towards raising money so we could hire a project coordinator. Getting both of these going again was challenging in a year that had both a provincial and a municipal election. But we're getting back on track now. I do strongly recommend that you listen to the guidance from Planet Youth and that you have a paid person who has protected time to lead the work in your communities. It's very, very satisfying work, but it does take a lot of effort. I can tell you that from personal experience. I can also tell you that the survey reports are starting some very interesting conversations across Lanark County. One example I'd like to give you is related to sleep. We find in our data that 70% of our grade 10 students are sleeping less than 7 hours a night. We also find that kids who sleep less than 7 hours a night and in grade 10 are more likely, quite quite substantially more likely to report that they've used cannabis, been drunk in the last 30 days or year, and that they report that they are, quote, not happy, close quote. I've attended some webinars that were put on by Sick Kids, and I've spoken with some other folks in Ottawa who are experts in sleep, and there is very much a strong correlation between getting enough sleep and youth mental wellness. So this suggests that addressing poor sleep hygiene could have a big benefit for young people in our community. So we see sleep as a protective factor, having enough sleep as a protective factor, and I think we'll be addressing that with some of our actions moving ahead. I found this example to be really useful in discussing how the survey data can support development of strategies across Lanark County. It's something that's pretty tangible and close, and parents can do it. So I really hope you move forward on your upstream journey. And on behalf of Lanark County, I offer and look forward to collaborating with you as we learn and share together. Good luck.
So these are just some examples of how this has been done in other communities in Canada. Of course, we have so many communities around the world, so if you still have questions, you want to know more, you can contact us and we can put you in touch. To wrap up, I just want to talk about the Planet Youth team, just so you know who we are. We're a really great group of people. We are about 19 now, I think. I think we're 19 full-time employees, but we also have ambassadors and advisors. As you can tell, we like to hike and be outdoors a lot. But we have people that are specialized in a lot of different areas, from community development and advising to mental health to communications. Our CEO is a business guy who teaches at a business school, valuation experts, and more. So you have well-rounded support when you sign on to Planet Youth. I don't know if you want to say anything else, yeah? Okay. Just so you know who we are, we're real people, and we're here to support you. And the last thing I'll just say is you can have a major impact in your community, and that's what this was all about today, is we just want to support you in having an impact, and we're here to help if that's the journey you choose to go on. Thank you.
Thank you, Jan and Robin, so much for all of that great information. And I know that you're both so available and open for if there's any questions. So we'll certainly be in touch with folks afterwards. And we're going to be doing a bit of a discussion in a bit where we might have a chance to ask a little bit more. But right now, I'm going to just move us into a little bit of a local snapshot of some data that we've got, just very briefly, from our region as well as from the province. So yeah, I'll take us through that right now. So in this first section, we're going to be looking at data from the Ontario Student Drug Use and Health Survey, or OSDIS for short. So it's a province-wide survey of grades 7 to 12 students that's done every 2 years by the Centre for Addiction and Mental Health, or CAMH. So when we're looking to capture data from our region, the health unit will pay CAMH to collect some extra responses so that we have enough information to compare regionally to the rest of the province. So the last time we were able to get this done was in the 2014-2015 school year. So that's the data that we'll be looking at. Of note, this is a school year that we're hoping that schools will take on the oversample, and so that we can have a bit of a more recent picture. But so I'll move us into this. So when looking at past year substance use among grades 7 to 12 students, we can see that students from our region, the North Bay Prairie Sun District Health Unit area, they were more likely to use alcohol and cannabis in the past year than the overall provincial average. Cigarette use was statistically similar to the province. And when we look at cannabis and cigarette use, for students that felt disconnected from their school, we can see that they were more likely to be using these substances than the overall regional average. So when looking at some mental health related indicators, the health unit region was similar to the province and other northern health units. So again, we're looking at 2014-15 school year for grades 7 to 12. So Approximately 1 in 3 students said that they felt depressed some or most of the time. 1 in 4 felt that they were not satisfied with themselves, and 1 in 5 rated their mental health as poor or fair. So looking at a different survey now, in January and February of 2021, the Health Unit surveyed individuals living in the Nipissing and Parry Sound districts who are aged 16 and older around the indirect impacts of the COVID-19 pandemic. So among ages 16 to 24 who responded to the survey, they reported that their substance use had increased since the start of the pandemic. So 22% reported an increase in their alcohol use, 30% an increase in their cannabis use, and 15% reported that their nicotine use had increased. So from that same survey, now looking at all ages, we're able to see that respondents that indicated an increase in their alcohol, cannabis, or nicotine use reported worse mental health and well-being outcomes compared to those without an increase in their substance use. So just to explain what's going on here, we can see that the blue bars, I don't know if you see the legend, I don't know where the blue bars represent those that reported an increase in their substance use, and the gray bars are ones that didn't report that increase. So people that reported that their use of alcohol, cannabis, or nicotine had increased were more likely to report feelings of loneliness or isolation, feeling stressed to the point where it had an impact on how they lived their daily life, feeling stressed to the point where they felt they couldn't cope with things, and thoughts of suicide or self-harm. So we can see those links there. Now we'll look at a little bit more recent data from the provincial level again. So we're looking back at the OSDIS, but it's from 2021. So as I mentioned, we don't have regional data from that survey, so we can't assume that this represents the exact situation from our area. And also of note, it was a year of COVID, so they had the lowest response rate that they'd ever had, so we have to interpret these results with a bit of caution. But province-wide, they asked students how easy or difficult it was to access different substances. So these percentages are for students who said that substances were fairly easy or very easy to access. So 61% said this about alcohol, 56% for e-cigarettes, 45% for tobacco cigarettes, 41% for cannabis, and 9% for opioids. This next chart shows some school and family-related statements that tend to be protective factors for negative outcomes, some of which we heard in Jan and Robin's presentation. So these include feelings of safety at school, feeling close to people at school, feeling like they're part of their school, and eating an evening meal with their parents in the past 7 days. So we see that these factors, they're shown for grades 7 and 8, 9, 10, and 11, 12. So they tend to change as grade increases. So feelings of safety and belonging at school tend to decrease, and then the likelihood of not eating their evening meal with the parents tends to increase. At the same time, we see that substance use changes as grade changes. So rates of alcohol, cannabis, and e-cigarette use overall tend to increase by grade. So a couple of the key messages from this data, past year alcohol and cannabis use have historically been higher in our region than the provincial average. Similar to the province, local youth mental health is a concern. The pandemic was linked with increased substance use among youth aged 16 to 24, and respondents of any age who indicated an increase in their alcohol, cannabis, or nicotine use reported worse mental health and well-being outcomes compared to those without that increase. Among students in Ontario, substances are not all that difficult to access, and certain protective factors tend to worsen as grade increases while the use of certain substances increases. So what's missing here? It's clear that we don't have recent community-based and periodically available data of the same quality as the Planet Youth data that we just learned about. So data that connects substance use, mental health, and other well-being indicators with risk and protective factors, and that's available consistently over time to show us how the situation is evolving. The OSDIS and oversampling is a great tool to give us a bit of that regional picture, but of note, the results take about a year to come back. And currently it's not part of an ongoing plan for action, which leads to the next point, that currently we might also be missing a comprehensive strategy that positions this data as a compass to guide evidence-based action, where the whole communities turn toward the data in anticipation of how it can inform their work and how it can track progress over time. So these challenges could be reframed as an opportunity to build something local where potentially Planet Youth could support us to meet the challenges. So that's it for me. I'll turn it over to Sandy now.
Thank you, Alyssa. To round out our data, it would not be proper to speak about youth without having youth voice here. So I'm going to introduce our special guests with us today so they can share their perspective. Ella is a grade 12 student at Northern Secondary School in Sturgeon Falls. She is a member of the Near North District School Board Student Senate. She is involved in her school as well as the community, including the Sturgeon Falls Curling Club and her school's curling club, where she will be headed to NASA shortly. Dora is a grade 11 student at Chippewa Secondary School in North Bay. She is also a student senator with the Near North District School Board and is an active student ambassador and a coach at Apollo Gymnastics. So welcome, Ella and Dora.
Good morning. My name is Ella Goulard, and I'm a grade 12 student at Northern Secondary School in the small community of Sturgeon Falls. I am honored to be here today, sharing the youth voice in such a great capacity. Today, I want to share a story with you that might answer a common question. Why don't teens go out anymore? I remember last year, me and everyone on my school's student council went outside after school one day to shoot a video for an upcoming contest. We all went out into the woods behind our school to film, and we were having a great time creating some high school memories. This was all interrupted when a woman came stomping into the forest, demanding to know what we were doing. We explained, and she continued to stare. It was not only extremely uncomfortable, but me along with everyone else in the group were stressed and afraid of what her reaction would be. When she left, the police arrived. Thankfully, they understood that we were doing no harm and let us continue, but who knows what could have happened if they didn't. It's not uncommon for teenagers to go out only to be met with glares from older generations. There seems to be a preconceived view that teenagers are always up to no good and have no regard for others. We go outside just to get funny looks and comments from adults. It's no wonder we don't want to go out anymore. It's easier to stay home, hide in our rooms, and ignore the world. Along with these misconceptions, teenagers are also ridiculed for not going out anymore. We're wrong if we do, and we're wrong if we don't. It feels that no matter what we do, we're bothering someone. Feeling like a nuisance doesn't help the generation that struggles so strongly with their mental health. According to a study posted by the American Psychological Association, Gen Z are significantly more likely to report poor mental health than any other generation. Though there is no simple fix to such a major global epidemic, hearing the voices of the future would be a great start. I believe it is so important to have youth voices at the community discussion table. In today's world, it's so easy to judge each other so quickly. We need to come together to discuss our perspectives on the world and plan how we can make the community more accessible for our teenagers to keep them happy, safe, and away from trouble. As a small start, I would like to ask just one thing of all the adults here today. Please, next time you see a young person out and about in your community, try not to jump to the conclusion that they're up to something. Just take a second to give them a smile or maybe even a hello. It might have more of an impact than you think. Thank you.
Hello, my name is Dora Chen. I'm a grade 11 student attending Chippewa Secondary School. I feel honored to be able to speak with you all today about how the Icelandic Youth Model could be a great support in the North Bay community. It is so important for adults to support youths in their environment by providing a substance prevention approach that is evidence-proven, theoretically grounded, and community-based. Between seeing and hearing firsthand, reading in the news, and viewing on social media, there's a significant amount of disrespect, disruption, and harm that students bring to the school environment. This includes increased violence in halls, washrooms, excessive swearing, and increased vaping and drug use. Behaviors such as yelling and arguing have also increased. Many of the students exhibiting these behaviors are stuck in a cycle where they feel as though they do not have trusted support systems within the school their household, or the community. They feel a loss in encountering the school and local population. Planet Youth could bring the community together and tell young people that they have support. It is great to know that with the Icelandic model, youth will have access to all the help they need to achieve their best outcomes. This could mean reduced drug use, improved mental health, reduced violence, and a better sense of belonging in the community. Youths need this opportunity. They need the support of adults around them. I know how much Planet Youth could help build relationships, success, and well-being for the young people in North Bay. Youths are surrounded by a culture of trying to keep up with whatever is deemed popular. They are often influenced by the lifestyle choices of their friends, peers, teachers, and family members. This culture was lost during COVID-19, as some youths had no access to a social environment. Some students lost a major development period in their life when experiencing the pandemic, especially those who are moving from intermediate to secondary schools. When students are suddenly put in a school that they feel no connection to and that they know nothing about, it affects their sense of attachment to the school. This disrupts connections between students and school staff, as well as relationships within the school and wider community. This disruption impacts confidence, self-esteem, and overall mental well-being. Youth's mental health plays an enormous impact on their daily lives. Many students within our school board have found issues in struggling with their mental health due to circumstances caused by COVID-19. These mental health concerns often turn a student's life upside down. And if a student does not think they have support within their family, school, or community, they may turn to utilizing dangerous methods of expressing their emotion and frustration. This could include using drugs or substances, or implementing violence, which can cause further damage physically and mentally. Youths are products of their environment. They are influenced by what they see, hear, and experience all around them. What if there was a way to use social factors that influence youth's decisions on drug use and apply them as a prevention method? And there was a collaboration of those in closest vicinity to young people in North Bay. Long-lasting change needs to be made available, not just quick and easy solutions. That is the strength of the Icelandic Youth Model. Planet Youth could help implement measures that would help students adjust and relearn to have a sense of belonging in school and public settings. Youths could learn to build relationships with both peers and trusted adults within their school and local population that could help support them. They would be able to grow to the best of their ability and improve mental and physical well-being. Having caring adults available can influence and assist youths positively. There can be a network of support, monitoring, and opportunities for positive youth development at the local community level. This will help the growth of many of our youths, the next generation. Thank you.
Thank you both, Ella and Dora. It's great to hear from you, to have your perspective on how we can do better as a community to support our local youth. As many of you here today could attest to, there is a value in having the youth perspective in the decisions that affect them. So thank you for taking the time to bring that to us today, and we will continue to keep youth in our conversations moving forward. I will now introduce Louise Gagne, the Executive Director of Community Services with the North Bay Parry Sound District Health Unit.
Thanks, Sandy, and it's hard following you two. That was very inspiring, thank you. We're going to be going into a discussion exercise in a little bit, but I wish to share with you some commitments that we as a community need to make if we wish to pursue having the Icelandic model in our communities. And if we want to invest in our youth, our future adults in our community. The first, as you have heard, is that we need to form a coalition or a project team, if you will. And this will be a coalition that is comprised of multiple stakeholders, partners, perhaps folks that we're not used to having at our traditional, healthcare and social services tables. And we need to make this a priority, and it's the first step. We also need to look at a sustainable funding model. As we've heard from Jan, this is something that we may not see the true results from until 10, 15 years down the road. The guidance program is for 5 years, so we need to, as a first step, secure funding for that 5-year period. To sign up for the project, it's approximately $36,000 to $40,000 Canadian per year. In addition to that, we need to look at securing funding to support our youth ambassadors, which could be an additional $5,000 a year. We also would benefit, as we've heard from other projects, of having a permanent coordinator to support this initiative in our community. And in doing our work of scanning other projects that have been implemented elsewhere in Canada and the world, the range to support programming and interventions that have been identified through looking at the data can range from $100,000 per year to $500,000 per year, depending on the size of the community. So yes, the program itself is $36,000 per year, but to make it successful and to sustain it and to see the results that we want to see within our community, we need to be looking at investing a lot more. We also need to commit to engaging with each other, breaking down those silos, working with partners that we haven't worked with before, getting out of our own lanes and working with each other on the common goals. And we need to commit to that over a long-term period. And that will mean, as we've talked about before, having folks working directly with us who we perhaps haven't worked directly with before. How do we bring businesses directly to the table with us? How do we bring sports and recreational agencies directly to the table with us? Because having them involved right from the beginning is critical, as is having youth, as we've just heard from our two previous speakers. Lastly, in order to see success, we may need to make a commitment to implement those initiatives and programming that we have identified as being evidence-based to support actually having an impact in our community. And we need to make that investment over the next 5 years, 10 years, 15 years in order to see a difference in our community. Thank you.
Thanks very much, Louise. I'm going to now take us into a bit of a discussion-based activity for the next 15 minutes or so. So you'll see on your tables, you've got these sheets here. I think there might be 2 copies per table. I'll explain shortly for folks online what the situation will be, but you'll see that there's a set of table topic questions that we were hoping that you would discuss with the individuals at your table. They're also up here on the screen, just to get you thinking. And what we're hoping is that since time is always an issue and we'd love to hear all of your perspectives, we would love it if you could write down in point form notes. They don't need to be tidy or anything, no names on the sheets, but just what discussion ends up happening at your table. You might cover all of the questions in the time, or you might really get into some good depth on one of them. So whatever you get to is fine, but we would encourage you to please write down so we can capture what discussion's going on in the room, and we're hoping to share back with everyone a summary of what we heard from people. You'll also notice at the very bottom there's a section for any burning questions. So through your discussion you might come to something you want to ask Jan or Robin or other participants in the room, so you can use that space to capture that question, and we'll take some time to go through those. So for those joining the live stream, there is a link that was in your Outlook invitation called Jamboard that has the same discussion prompts and questions on it. So there's some simple instructions in there for how to use it. We also have Shannon in the room who's in there just monitoring and making sure everything is going smoothly. And there's also a space for questions in there. So I'll start the time now. So we'll have about 15 minutes for the table discussions, and then we'll bring it back for any questions or other discussion points we want to chat about together. Thanks.
already starting to swap.
about 3 more minutes to just wrap up your discussions and think about any questions if you have them. Okay, so I'll call everyone's attention back. So, hopefully you had a chance to connect and put some stuff down, some different ideas. And I wanted to start, we're going to kind of work backwards through the sheet. We'll look mostly at the questions. If there were any, like I mentioned, I'll be collecting the sheet, so we'll get a lot of those discussion points. But were there any questions that came up from your table that you wanted to ask either of the presenters? I'll mention too that they have a flight that they need to catch, so they'll be with us till about 11:30. So after that point, we could continue with discussion in the room here, but to tap into their expertise, we'll have till 11:30. So any questions? Oh, yeah, did you want to come up to the mic at all, or up to you?
So I think I heard you correct where you're asking about local ownership and who owns this, and it's really the community. I mean, there's going to be a partner who signs the contract with Planet Youth, but that's no one's to own. It is the community to own. That local coalition is going to take the initiative and the lead. So I would say the community owns it. Does that answer your question okay? It does. Okay, perfect.
May I add? We're not the same size, Robert. You don't only own that, but also when you get the data, I mean, we use the data, we crunch it in order to be able to deliver you the reports, your working tool basically, but at the same day that you receive the reports, you also receive a cleaned, complete data set. So, which is for you to use, and if there are people like maybe scientists or people from schools, universities who want to explore deeper and maybe write scientific papers and things like that, then that is also yours. So I just wanted to mention that.
Just to repeat the question for those online, it's about how they collect the data.
This is one of the questions I love. It's, okay, first of all, there is the questionnaire, which is standardized, a core questionnaire with questions that make sure that we can answer you about the situation and the risk and protective factors. If there's something in the questionnaires that is totally not appropriate in a local setting, then we of course have to revise that. And also if there is something that you absolutely need to know and is not applicable in other locations, we can add that to the questionnaire. Okay, so that's the questionnaire. Then we set it up, and the students, they answer it. It's all electronic. They can answer it on their phones, tablets, computers, however. And it's kind of fun to answer because we've set it up so that the next question just pops up. You don't have to say enter, yes, confirm, da-da. It's like Candy Crush. You know, just get the next one. And we only need one class hour, 40 minutes. So that's it. So we also have to establish one contact person. You would have a team leader here and a team who would provide us with a list of contact persons with emails in each and every of the schools. So one contact person per school. And when the data collection starts, we say it will start next week, we send a link and a password. It's the same link, different password to each and every of the contact persons in the schools. So now is the day of the data collection, and the teachers, they write the password on the whiteboard. So then when the students start answering, we know from which school that answer is coming. But we don't know which student, of course. That's totally anonymous. We can also monitor the responses in real time. And we require 80%. We want that. And let's say after 3 days of data collection, there is a school, and it's only up to 25%. Then we send a memo or an email or something to the contact person asking what's going on here, because we know how many students there are in the school from the school contact. And we always get the same answers. You know, sorry, there was a substitute teacher who didn't know, we forgot, there were so many sick, flu or something, the kids were traveling on a school trip, something. So then they can get a few more extra days until the response rate is up to the level that we need. And yeah, please.
So how often do you survey the students? Is it just in the schools, or is it offered elsewhere?
It's normally in the schools. That's where it is easiest to reach them. This is normally every second year. Some municipalities, communities want to have it every year, but normally every second year. We have ways to collect data outside of school, something that we needed to create when COVID started. It's called a home schooling data collection protocol, something like that. But the schools are the best place to get this. So, and when the students answers, the response goes up to the clouds, they tell me, my young people, and comes back down in our systems, and we crunch it, clean the data sets, and start. That's the, is it, yeah, simple, clear? Answer the question?
One more question.
Of course.
What data are you collecting?
Sorry?
What are some sample questions of the data that you're collecting?
What are the,
What are some sample questions of the data that you're collecting?
what are the questions?
Yeah, like could you give us some examples?
Yes, I mean, these are all questions about the, I mean, it starts with your gender, you know, different sexes, your age, and it goes through, you know, your relationship to your parents, friends, leisure activities, how you feel, your perception of your own physical health is, or mental health, and of course all the questions about substances and yeah, everything that we need to know so that you can be sure that you have what you need to work with when you get the reports. The core questionnaire is lying somewhere. You can probably just see it. Okay, thank you.
Hi there. Thank you. My question, actually I have two questions. One was, one of the most interesting things I saw in your data was the stat around how much time teenagers were spending with their parents. So in one of the first slides that you showed, it looked like time spent with parents on weekends was increasing in Iceland with the implementation of this project. And I'm just wondering, you know, given how long the project's been running, and one of the most drastic changes that we've seen in society is the introduction of the smartphone. Does the survey capture screen time and make any correlations to, you know, that screen time and how that relates to those parent relationships?
Yes, we most definitely ask about screen time, and we've also published some papers, at least one or two, on the effect of screen time on mental health. And it's, I don't remember the journal now, but we can see that the strongest correlation between worse mental health, especially amongst girls, is the more hours they spend on social media. The second correlation is inequality, if you feel not equal to your peers, and of course third, bullying. But yeah, we do a lot of that.
From the time that we sign on and say roll this out, the fees are paid, whatnot, develop our committees, what is the timeline between that and the time that you actually start to see some of the effects in the community? So for example, we have youth in this community who are already ingrained in certain habits and traits and whatnot. If they're already in grades, say, you know, we'll go median, say 8, 9, is it conceivable that they will see any kind of benefit from this, or are we looking at a longer term stretch?
That's a great question, thank you. The short answer is it's kind of both. You're gonna see that all youth are gonna have some sort of benefit when you're bringing all these stakeholders together to talk about youth well-being. You're probably gonna create some goals and strategies in that first year that are shorter term goals and strategies along with those longer term goals and strategies. So depending on what your community decides it needs, I think your young people, regardless of their age and what cohort they're in, are gonna be impacted. That's up for you to decide. But I would say that yes, you're gonna have those short-term impacts along with the long-term impacts. Does that answer your question okay?
I guess I was just curious about that in terms of, you know, should we be looking at having some kind of other programming running at the same time that addresses the current issues as well? Because as you say, this is not an immediate solution to the issues. So there will be kind of a, I guess, a gap in who gets caught and who doesn't. You know, it will be more impactful, I guess, for the student in grade 1 coming up than it will be for the student currently in grade 7, 8, 9.
That's a great question. And so something that I didn't say in kind of the community-based approach, which I often talk about in the coalition building training, is that you're not going to replace anything working well in your community or anything needed in your community. We're not saying you've signed on to this and you're working on primary prevention, so forget about the secondary prevention. You're still going to need that. You might see less need for it as time goes on. As Jan can talk about in Iceland, you know, their youth treatment centers have slowly kind of diminished because they just don't have a need for that anymore. But that's not going to happen overnight. So we're not saying replace anything that's working well or anything that's needed. We want you to utilize the resources that are working well, and that's something I talk about a lot with coalition is don't replace what's working well. If you have an established coalition, go with that. If you have goals and strategies that are working well in your community or policies, build off of that. So I think if you take what's working well and then add these shorter term goals and longer term goals into it, you're going to reach all youth in the community. You're also going to have an impact on the adults in the community. Those parent cafes in Frankfort, Kentucky are bringing parents together and improving their youth engagement and also their mental health and well-being. So it's going to help everybody.
Hi, I have got questions on behalf of the live stream participants. So they've shared lots of appreciation for Ella and Dora, so I wanted to pass that on, as well as the question, how is the youth's voice being incorporated into the implementation beyond just the survey data collection?
So this is kind of a multi-part answer. So first thing I'll say about youth engagement is that the responsibility never falls on the young people to have to change the community environment. The adults should be taking responsibility. Just like the community's taking responsibility, the ownership doesn't fall on the schools, the community's taking responsibility, so this doesn't fall on the youth. However, the youth have a big impact because they're taking the survey, they're sharing their voice, they're sharing their thoughts. Some communities go beyond that, where they want to engage youth more in the process, and they'll have things like youth councils, and we'll present the data to the young people, and they'll be able to give us feedback and share what they're experiencing in the community. You can dive deeper into some of those results that you'll receive. Some of the youth councils also get funding from the community to make their own kind of goals and initiatives that they think are going to help. So it depends on the community. Some communities decide that the youth survey is enough and maybe getting a little more feedback after the survey is important, but other communities really take it much further and have their own youth councils. I hope that answers the question okay.
Yeah, this might be the last question we have time for with our guests, but we'll sort of see how it goes. But thank you for coming up.
So since this is community-based, I would imagine there's a large percentage of, or a large portion of training that would go on how to recruit and retain volunteers. And what does your training offer in building a network of volunteers that would assist? I mean, it's great for the community to give people the opportunity to volunteer. Great for the adults, and of course, great for the kids. So what can you say about that?
That's a great question. So we offer a lot of training, coalition building trainings. We offer that training series about how to work with your results and all that. And so not only can the coalition attend those, if the coalition thinks there's community members that should be involved, they can attend those trainings as well. So that's an open opportunity for your community to decide who should be there. The one thing I'll say about volunteering is it happens a lot in the communities where people need to volunteer to do this work. However, we highly recommend that people that are participating, especially on the coalition, have paid protected time to do so. Otherwise, you can burn out really fast. We want people to be able to focus on this work. we don't want it to be a secondary job on top of their already probably busy job. And we know that's not always possible, for example, with parents who have a full-time job and they have family and they can be really busy. So what I'll say to that, if you are doing kind of maybe some volunteers and adding them into this process, offer a wide variety of commitment levels to the work. Not everybody is going to have the same time commitment, but you're going to want to capture that engagement if they do want to be engaged. So while someone may be able to sit on the coalition, another person maybe can review some materials before you send it out or create some materials. And another person may be able to just forward on an email to their contacts. So offer a wide variety of commitment levels for your activities.
All right, I think it is time for our guests to head off for their flight, but I wanted to just give one last thank you. We're so grateful for you to be here to share all of your expertise and knowledge and to answer all of our questions. So again, thank you, and maybe we'll give them a round of applause. Right, so as they make their way out, we can continue the discussion. On the bottom of the sheet, there was a little prompt that if you had questions for other participants in the room, so I don't know if anyone got to that type of a question, but if there was something, I'll just leave it open for a moment to see if there was a question for other participants. Right, and if there's none, that's totally fine. So I'll give an opportunity now that was there anything from any of the table topic questions that your tables might have discussed that you wanted to share with the group? Any like really good insights that came out or something that you wanted to share with the broader group? Oh yeah, I see one at the back. Did you want to come up to the mic, please? Or we can bring it to you too. Thanks, Alex.
Thank you. Our question at our table was, if all other organizations in our community are struggling for funding, how do we put a focus on this project?
Yeah, so that is a great question, and I don't know that I'm the best person to answer it, but yeah, there was the funding question that, did anyone else in the room kind of come to something on that? Thanks, Heather. Take care, safe travels. Awesome. So the question was around if organizations are struggling for funding and if, like how would we kind of prioritize that? That was that. Yeah, oh, I see a hand up at the back. Here, I can, let me know if you want me to travel around with the mic. Sorry, it's just so people online can hear, so maybe we'll get you to repeat that.
We threw around the idea of the casino money to go towards some of this.
The casino money, that's a great idea. Awesome. Yeah. Was there anything else that anyone wanted to share with the broader group? As I mentioned, we'll be collecting these papers so that we can kind of share back in a little bit of a summary for everyone.
Great question. I think this comes back to collective impact and looking at our own mandates and how this work fits into that and the goals that we have already identified in our own agencies that align with this. And then having those tough decisions about internally in your own agencies about, are we better to be working alone with our little piece of money, or would we be much more impactful if we looked at that money and pooled it with other agencies and their little bit of money And then maybe if we all put a little bit of money, we can make a sustainable pot that helps move us forward. Because many of our agencies are working under similar goals. We have similar individuals that we're trying to reach and serve in the community. And where does this fit in terms of supporting our youth in being, successful, well-rounded individuals and contributing members of our society moving forward? They are our future adults. So we need to think about where this fits in a bigger picture. There are also examples from other communities where they have leveraged fundraising. So they have sought assistance from agencies such as the United Way, Rotary clubs, those sorts of organizations, to help them with fundraising efforts, particularly to support particular programs or initiatives that have been identified as being effective and that they want to implement to make a positive outcome. So there will be a desire to have some base funding that we can rely on year after year, but then we will also need to likely look at fundraising models year after year to support some of those priority initiatives that will be coming out. Dr. Zimbalati, is there something?
Yeah, I just wanted to add too, as Louise highlighted, a lot of us here today that we work on similar issues, and sometimes in parallel and sometimes with some duplication. And so by all being at the table, all discussing, and not just our typical agencies that seem to be at a number of tables addressing different issues, that if we're all at the table, community partners and many new partners that are joining us, and we're working collaboratively and not duplicating our efforts, we're pooling our efforts towards this one larger goal, then I think we have more opportunity to use funding more efficiently as well.
I'll just add one more thing, that several of us in this room have applied for community action grants before, and not that we want to rely on grants, but if we do need grants to support particular initiatives, that we look at preparing them in a strategic way, that instead of as an individual agency submitting a community action grant, we discuss it at the collaborative and talk about what goes into this grant, and maybe we submit several grants and they're all sort of leading towards supporting particular initiatives relating to Planet Youth. So that's just another example of opportunities to work together, even in terms of applying for individual grants.
That's great. Thank you both. So I think at this point we will move over to our final wrap-up, but as I mentioned, please leave those larger sheets on the table and we'll collect them to gather your responses. So thank you so much for participating in that.
I will take you through the last activity. It is called the pulse check. You will find one for each person on your table. This will be kept individual. We will not be collating this information. We will not be sending this back out. But this helps us to know, was today worth it? Will we be calling you back? Who are we calling back to the table? And what does that table look like? So on there, you can fill out your name and your organization. I know many of you are wearing multiple hats here today because you have side jobs and evening things, and you sit on councils as well as work for places. So put all those down because that might be helpful. So the first piece of that says, after today's event, where do you sit with the possibility of implementing the Icelandic Prevention Model locally? And you can sort of choose where you're sitting. We won't hold you to this. This is just helping us know what we need to do next. And then we want to know about the level of involvement you personally would be interested in. So we know that not everyone has equal time to commit. So we're trying to understand, do we have a lot of low commitment folks, medium commitment, or is there some sprinkling of high commitment people here where we know we can lean on your organization a little more heavily? And then on the back, it's the role that you see your organization taking on, and you can check any that apply. And then finally, while we move forward with this, what should we make sure to not forget about? We know not every partner's in the room. Some partners couldn't make it to this event today or yesterday. Some had other conflicts of time. We also recognize that some of our partners have day jobs, and what we would want them here for, they couldn't make it. So some of our folks in recreation, they couldn't be here today. So who are we missing so that we make sure that we have those voices? And you can either leave those on the table, we'll collect them, or you can pass them on the way out at the reception table. And so finally, we will close up today. And I'd like to thank the speakers. Thank you, Ella and Dora, again, for bringing your voice to today. Thank you, Alyssa, Dr. Zimbalati, Louise, and Jan and Robin, who have already left for their flights. Thank you to all in the room for prioritizing this important conversation this morning. As we heard in the opening remarks and saw in the evidence of data, the trends of substance misuse and mental illness are high. And this morning has confirmed that the reasons are complex and not one organization or sector is equipped to reverse the trends alone. The solution that we presented today will not be linear, and it will require commitment and creativity to reduce the barriers. We believe the end game would be worth it, and that our youth are worth it. I know you will need time to digest the morning, to speak with colleagues, to share the inspiration that you felt in the room, and we will follow up with an email containing the PowerPoint slides, information, and as well as the video that was captured today. Planet Youth works, and it works by bringing the community together to address risk and protective factors in the environments where youth are growing up. And we need your support to bring the whole community model to fruition. Thank you.